Professor Carroll, thank you for giving your time today. Tell us about today and why it is important.
It's my pleasure, Tissa. It's been a very exciting day where the latest information on the global burden of neurological disease has been discussed as it's being made public. This is for the first time we have stroke now included in neurological diseases, which has catapulted neurological diseases, particularly non-communicable diseases, to the top of the burden of neurological disease, which is probably where most of us in neurology think it should be and should have been all along. But more importantly than that, it will provide a framework with which to plan ways in which we can improve services to tackle this ever-growing burden of disease, but more importantly of disability and cost to the societies. There were a number of papers that were discussed or presented and discussed here today also, which indicated that people are starting to think about how we may implement plans to try and mitigate these problems in the not too distant future. So that too is exciting, and there's no doubt that this exercise in the global burden of disease measurement has been the catalyst to do that.
What is your message to our members representing World Federation Neurology worldwide now that neurological disorders are leading cause of disability? We are moving towards implementation, we are moving towards therapeutic era. How would our members and member societies worldwide would take this to policymakers and funders? What is your message to them?
Well, I think that my message is that they can use this as a tool to leverage services, leverage access to medicines, and to tackle the problem. But each nation will have a different system, a different set of needs. But I think that the data included in this burden of disease document will enable them all to be able to use different aspects of it to their advantage.
Finally, our big meeting is coming up. It's not far, in Dubai. What is your message to our members and member societies about Dubai? Anything that you can tell at this stage?
Well, I think Dubai will be an exciting meeting. It will be a very informative meeting, and it's in an area of the world where there is quite a bit of growth in activity in neurological care and in some forms of research also. So I think that from the point of view of straight neurological topics, it will be exciting. I've seen the program, I'm excited by it, but I also think that there will be, if at all possible, a World Health Organization presence, because that's where we, the WFN, have to work with most in order to tackle the problems that have been clearly enunciated by this global burden of disease. So there is a link between today and Dubai, but obviously Dubai is where most of the excitement will be.
Thank you. Thank you very much for your time.